A lot of psoriasis patients, feel like it's something they just have to deal with. And, I've had many cases where people have been covered with very thick plaques. They haven't responded to Western medicine, and again, have been able to get their skin completely clear.
The level of the severity is so important too, because, what you're talking about are really severe cases that will heal, but they just take time. And so what people have to be aware of is that, the more severe, the longer you've had something, the more time it usually takes in order to heal.
It's a commitment to do the treatments, to do the herbs, to do the topicals, but the results from it can be sustaining throughout the years, through a lifetime. So you really get the benefit of it in the long run. The approach that I've learned has been based on 3 stages of treatment, where the first stage is really about kind of clearing the symptoms. You don't really address any of the underlying constitutions in terms of herbs at that point. You can with the needles, with acupuncture, but with herbs, you have to avoid that initially.
Once we have the symptoms under control, is how do we actually strengthen the body so that you're literally reversing the triggers that were bringing this on in the first place. And then it's just, an occasional treatment throughout the month or year in order to maintain it. Welcome everyone who is joining us. This is collaborating with healthcare professionals on our Holistic Health Associates page. And I am Ryan Diener, and super excited to have with me today Kuhn, who is the owner and founder of Elevate Wellness, which is an acupuncture and Chinese herbal medicine clinic in St. Petersburg, Florida. And she is also a trained and licensed social worker, and she is also a very good friend. And so I am just thrilled to have the opportunity to chat with you today, Kim, about everything Chinese medicine, and specifically about your specialty, which I don't think most people know about, which is dermatology. So tell us a little bit about just how you got into the field in general, and also for people that don't realize that there are specialties, how does one end up with a specialty like dermatology in this field?
Okay. Well, I'm excited to be here. So thanks for doing this with me, Ryan.
Yeah.
In terms of how I got into Chinese medicine, I had been a counselor as a licensed clinical social worker for many, many years, and had experience very early on when I was practicing in Virginia with the Acu-Detox protocol, and just seeing the profound effects that had with addiction. And then ended up referring so many clients to acupuncture for all sorts of conditions. So I found after just getting burned out, I had such a desire to work with a person in a much more holistic way. Like for me, it felt limiting to just work with the mind and emotions and all of that. So I went back to school, and during my time in my Chinese medicine program, I was introduced to the field of dermatology, and was really blown away by the work of Mazen El-Kafaji, who is the person that I ended up studying with. And to me, it really kind of hit home because my dad has vitiligo. And so I saw the impact that had on him through the years. Mm-hmm. And when I saw the results that Mazen was getting from his approach with patients with dermatology, I was astounded. And he practices in the UK, and he started coming over to the US for the very first time to teach. And I started taking classes with him back in, I want to say 2013. And then he offered his dermatology diploma certification in the US for the first time back in I think 2015 to 2016, or it might have been 2016 to 2017. So I finished the year-long program with him and was able to integrate it pretty quickly into my practice. And the results that I saw firsthand were incredible.
Incredible. That's great. That's great. And so for those people who don't realize it, for acupuncture, for an acupuncture degree, we go to school post undergrad for 4 years to get a certification in acupuncture and Chinese herbal medicine. And then when you specialize, it's very much, has kind of some similarities to the Western model, which is that, Kim went for an additional year, probably multiple weekends over that year, coursework in between, exams, et cetera, in order to become a specialist within the field. So fantastic that you went about that. But I just wanted to kind of highlight that for people that don't realize it. Specialties within Chinese medicine are 5-year programs, essentially 4 years for the master's level, and then at least 1 year for a specialization. So many acupuncturists do tons more continuing education than the average medical professional. There's so much history. So, but I wanted to get back to, you were talking about the results that you get for dermatology. So tell me a little bit about some of the primary things that you're seeing incredible results with. What are some of the primary conditions that you see regularly? And give maybe an example or two of just like what you've seen on in that front.
Okay. So I would say the most common conditions that I have seen have included psoriasis, a variety of types of eczema, rosacea, acne, and I have seen a number of lichen simplex cases as well. But I would say the other 4 are the ones that I most commonly see coming into the clinic. Mm-hmm. I have treated people with vitiligo as well. I find that people with vitiligo have been told for so long that there's nothing that can be done, that they often don't realize that there is a treatment option for them. So I do see vitiligo cases coming in, as well as people with alopecia.
Interesting.
So in terms of some of the things that I've seen with patients that I've worked with, one case in particular in terms of eczema, which I would say was the most significant in terms of results, is I had a patient who had eczema since she was very, very young, and she is currently in her 30s, and she had been prescribed steroids from a Western dermatologist for years. And she ended up having some pretty strong reactions to them, because if people do it for too long, their skin actually starts to atrophy and they can be past the point of being able to heal at that point. But she also ended up going through a steroid withdrawal flare, which basically impacted her entire body, where her skin head to toe was red, scaling, flaking, cracking, oozing. It's incredibly painful because you can't even turn without your skin basically splitting open. Very painful, very uncomfortable. And she was not getting anywhere with Western medicine because they were wanting to put her back on steroids. So she started to see me for both acupuncture and herbs. And, it's a long process to get results in cases like that, because it can really border on, a real medical emergency at that point. Mm-hmm. But her skin started to clear pretty quickly. And at this point, she has 2 very tiny patches in the just crooks of her elbow, and just a little bit on her chest. And it's the last areas that we're clearing. And the rest of her skin is normal for the first time in her life. So those results have been incredible to see, because this is somebody whose entire life was impacted by her skin condition. So seeing those results, it's so rewarding. And other people who've, like a lot of psoriasis patients, feel like it's something they just have to deal with. And, I've had many cases where people have been covered with very thick plaques. They haven't responded to Western medicine. And again, have been able to get their skin completely clear.
Mm.
And yes, and a lot of times it is something that they haven't ever experienced of having, clear skin.
Mm-hmm.
And same with rosacea. People often will go to dermatologists and they feel like this is something they just have to live with. They don't realize that there's other answers, other types of treatments. So it's really incredible to be able to offer solutions to people, though it is an undertaking. And I think people just have to know, like, it's not something you're going to go in and it's going to get fixed within a matter of like weeks. It's a commitment to do the treatments, to do the herbs, to do the topicals, but the results from it can be sustaining throughout the years, through a lifetime. So you really get the benefit of it in the long run.
Yeah, for sure. And like there's the level of the severity is so important too, because what you're talking about are really severe cases that will heal, but they just take time. And so what people have to be aware of is that, the more severe, the longer you've had something, the more time it usually takes in order to heal. Some people watching may not know this, but this is actually one of the ways that I got into acupuncture. So my quick background on this is that I had rosacea and seborrhea, the two of the things that you're talking, and eczema, all three. And I had it on my face. So it's a common area that people get it, right? They call this what, the butterfly area, Kim?
Mm-hmm. Yep.
Yeah. So you get, it's between the eyebrows and then on the cheeks and then a little bit on the chin. And I had been going to Western, dermatologists and getting the topical steroids, and it would go away for a little while and then it would flare back up. And
Right.
to your point, you get these kind of like withdrawal flares almost. As soon as you think it's gone and you stop using the topical, it comes right back. And I knew that there was if you use these long term, your skin can get thin. It can, it can get discolored. And I didn't want that. Well, I had already signed up for acupuncture school because I just loved the philosophy. Had never had a treatment before, and I just was excited to get started with it. My first 2 months in school, I went and saw a teacher that became one of my greatest mentors, and he put me on herbs right away, potent herbal teas, and I was getting acupuncture twice a week. And in 2 months, it was like I had never had it.
Right.
So depending on the severity, mine wasn't like head to toe. It wasn't thick, patchy. It was just red, burning, itchy, uncomfortable, which is bad enough. But but within 2 months of having really intense treatment, it had cleared up. And then it was just making sure that it stabilized. So, dermatology is very close to my heart when it comes to this medicine. I love to treat it. And much like you, I've seen incredible results. So it's nice to know that there are options here. And so it kind of brings up the question, if somebody is thinking about coming to an acupuncturist for a skin condition, why would they do that? Why would they choose to go to you versus a dermatologist? Or how does that integrate? How has that worked for you?
What I find is that with Chinese medicine, when people are choosing to come to acupuncture and do herbs, they're wanting an alternative. And so a lot of times people are showing up to a Western dermatologist first, trying to figure out what's going on. They're offered some solutions. And I think people do start seeing that backlash from being on steroids, that they do get that flare afterwards. So what I have found is that people want hope that this isn't something that they just have to live with. And so when people come in, and I think ideally, like in your case, I think it's a great example of when people access Chinese medicine early on, it can be a much quicker treatment. And the approach that I've learned has been based on 3 stages of treatment, where the first stage is really about kind of clearing the symptoms. You don't really address any of the underlying constitutions in terms of herbs at that point. You can with the needles, with acupuncture, but with herbs, you have to avoid that initially in most cases, not all situations. The second phase is when you do start to incorporate in some of the underlying imbalances in the person. And then the third stage is about really solidifying and consolidating the treatment so that you're preventing further flares down the road. And that's where I think acupuncture and Chinese medicine can really stand out because, people do think, well, this is just something I'm going to have to live with. And when you see it all the way through and you're able to correct those underlying imbalances and really treat the whole person, people don't have to deal with flares down the road. Like they can have sustaining relief like you've experienced where that healing lasts.
Yeah, for sure. For sure. And I think that is such an important point because, the relationship of symptomatic care versus resolution care is really valuable, right? When you get a steroid cream, you're getting symptomatic care. You're trying to just deal with the symptoms. And we do the same thing, right? We want to deal with the symptoms first, like you were saying. Then we want to make sure that it's stable. And then we want to make sure, which means essentially that under duress, doing things that you would have done in the past that would have caused that flare, you're not going to continue to get it, right?
Exactly.
You can now go out in the wintertime and you don't have to cover your face, and you can be exposed to the cold wind and you're not going to get like redness right through here. Or you can take a shower and you don't have to worry that if as soon as you start drying it, your psoriasis is going to get worse. You want those, you can drink a glass of red wine and it's not going to flare. You know what I mean? So those are the things that I think we really focus on once we have the symptoms under control, is how do we actually strengthen the body so that you're literally reversing the triggers that were bringing this on in the first place. And then it's just, an occasional treatment throughout the month or year in order to maintain it.
Exactly.
Yeah, cool.
I think that's really key too, because, whenever I start working with a dermatology patient, I am most cases having to tell people no alcohol, no spicy food, no sugar, you're having to restrict anything that's putting heat or fire into the body. And I think a lot of times people fear that well, is that going to always be the case? And what you were just saying is exactly right. Like once you get through that first stage and you start to really correct those underlying imbalances and you bring somebody back to their optimal health, they can integrate those things back in and live their life without having to feel like it's a constant restriction to control, whatever their skin condition is. And then it is a matter of just continuing to take care of your health and well-being so that can sustain over the course of time.
Yeah, for sure. Fantastic. So just in kind of like to closing, to kind of wrap it up, if somebody was looking for a dermatology specialist within the field of Chinese medicine, do you have any idea how many people there are out there doing this, or like how to find them? And and if there's nobody that is local that is certified, what are some good questions that a patient can ask in order to say, hey, is this the right practitioner for me to help with my skin condition?
So in terms of finding practitioners in the United States, I believe there are 70 of us at this point that are board certified through the traditional Chinese medicine dermatology board that Mazen Al-Kafaji founded. Mm-hmm. And his website has a list of practitioners based on country, and for the United States, based on state. So I can get you that website. His clinic is called Avicenna, and he has a list on there. There's also a company based out of Colorado, Zai Dermatology, which is Zai. And the woman who owns and runs that clinic, she has a great line of dermatology products as well, topicals. She has a list of United States providers on there as well. Mm. So you can access those two websites, see if there's someone in your area. I will say a lot of the practitioners are located in California, which is where I did my training, New York City, where he also offered it. And I think there's some in the Chicago area, and then a couple of us sprinkled around the country. So I do know that a lot of us have done telehealth appointments in terms of the herbal component. And that is something that can always be accessed to work in conjunction with a local acupuncturist who doesn't have that specialty. So I think it's a great way of blending and collaborating with two practitioners. But in terms of, if there aren't those options, I would say talking to an acupuncturist, just based on their experience of working with dermatology, I will say that herbs is a critical piece. Mm. People who are doing just acupuncture, I don't find the same results with it. I find the best results with acupuncture and herbs. Agreed. And somebody who's going to use ideally loose cooked herbs, because it is the strongest form. And I think just finding out like what their experience is and what their approach is and the kinds of results that they've seen within their own clinic. Mm-hmm. Because I have found that people can get, frustrated pretty quickly, or feel like they'll close the door on the use of acupuncture if they don't get those results quick. Mm-hmm. And I want to see, like, even if it takes a while to get all the way through those 3 stages of treatment, I want to see results within like 2 to 3 weeks that things are shifting. Yeah. Yeah. So, I think just, talking to practitioners and getting more information about experience is key.
Fantastic. Well, this has been delightful. And as I say to many of the people that I have spoken with on these videos, I really would love to just talk for 3 hours about this or 4, and and
absolutely,
it's a lot of fun, and it's something that we just love to do, and I just appreciate your time and your expertise and all of the things that you bring to the table within the field of Chinese medicine. So thank you for that.
Thank you. Yeah. I think it's great you're doing this just to increase awareness on what all acupuncture can treat. So
yeah, for sure. So thank you guys, everybody who's watched this, and we will see you next time.
Bye.